Hello.
Hey.
So, for anyone watching tonight, let me introduce Dr. Ada Emerewe, OBGYN um, in Maryland. Ada has so many, Dr. Emerewe. First of all, what am I going to call you? I'm going to call you Ada
That's
because it's going to
perfect.
be.
That's perfect, actually. Because then, I mean, it's two OBGYNs. We might as well act like we're talking on the phone, you
We
know?
might, and you know what? That's the point of this whole endeavor. And so, for those that you're watching, Ada and I've been friends for many years. We actually have been friends since we were in school and both entered the field of OBGYN
Yes.
together. And so,
Yes.
we thought that it would be nice to bring to the audience just us, two OBGYN.
That's all y'all getting, y'all. Hmm.
So,
But it'll be worth your
it'll be
while.
it'll be worth your while.
Yes.
And as I was saying before, Dr. Miraway has so many titles, um, that she so many hats that she wears, more than just being an OBGYN, that
Hmm.
we would take the length of our broadcast to go through them.
The most important one is mommy.
Yes, yeah, you're right.
That's the one I am. That's
You're
the one I
right.
wear all day, every day. So if my child runs behind me naked, no judgment,
Yeah,
please.
just another day.
That's another. Is there a day at the end of day? Then
It's-
most
that's where
likely
we
my child will be running around naked.
are. So
Continue.
during this time, we'd like to just go ahead and, bring one or two questions that we have fielded throughout the week with the patient and get each other's perspective and have conversation around it. Feel free during this broadcast to share a question that you'd like us to answer uh, in the future, and we can do that. And I'm going to put my phone on silent.
I think that's a good idea. I'll do the same. I always say during the appointment, it's always when the speculum is in the vagina that that ringtone rings. They just know. I mean, the whole time we've been talking,
No.
silent,
And if you're like me, your ringtone is on loud so that you
loud,
can always hear
loud.
when you're on call. You don't
Yeah.
sleep through it,
hmm
and then you can
Some
find your
some
phone.
ringtones shouldn't be ringing. So
So I had a patient earlier this week, and her question. This is a very mild question.
okay.
Her question was, but do not let it dictate your question, okay? Because I know you have some spicy ones. But her question was very simple. In her family history, a lot of women have had hysterectomies, and she is having some bleeding issues and wondering, is it time for her hysterectomy?
Mm.
So
And
what are
so
your
her
questions?
question is there a genetic disposition, or is there a reason if my mom and my aunts have had it, does that mean I need one too?
Yes.
Was that the crux of it?
Hmm. Hmm.
So I think it's a very important topic, because hysterectomies are one of the most performed surgeries in the world. Very well known. Most women have heard of it or know someone who's had it done. So I think it's a reasonable concern, when most of your family members have gone through the procedure, to think that you too might need it. I think the important thing for women to know is first the indications for a hysterectomy and the reasons why you would need a hysterectomy. And so I think for the most part, having that conversation with your OBGYN is really, really important. But also just, having the conversation with your family is another important piece. What I found most often is women don't really know why they received the procedure, they underwent the procedure. And so kind of getting through the background of that and why that has happened is helpful for the medical history to determine if you are a candidate for the procedure. The most common reason why a woman would need a hysterectomy most likely is fibroids. So most women have heard about fibroids or benign growths in the uterus, and this can affect many women in one family. But due to the advances within medicine, back in the day, hysterectomy was the end all be all, the only treatment plan for someone who had uterine fibroids and who had abnormal bleeding. But now there's just so many new technologies out there that are more conservative and less invasive than a hysterectomy, that although you may have the same condition that your mom or your aunt or your sister had, the treatment plan may be very different. So I think it's important to first know the indications for the hysterectomy, but then also to make sure that you're getting information from your family members to understand why they got it in the first place, and then discuss with your OBGYN all the many new technologies and different technologies there are. And you may end up needing a hysterectomy at the end of the day. But I think when you compare options of 10 years ago to now, we have so many more that don't necessarily require you to undergo such an invasive procedure. So that's what I would say to her, that you don't have a genetic disposition to needing a hysterectomy. A lot of women, particularly in the African American communities, that was what the treatment was. And a lot of women just didn't know why they were getting it done, or didn't know that there was a less invasive approach that could be taken. So having these conversations is really important for that reason.
Yeah. Even in the last 3 years, I would say there's more advances, new medications,
Yep.
Orion, Myfembry.
Yep.
So there's a lot, and what you're saying is true about certain populations getting more surgical procedures,
Yeah.
more definitive surgical procedures than others, African Americans, black women as a whole. So, we've had this discussion a lot. And I
Yeah.
think, oftentimes I feel that we as OBGYNs may say, oh, if you're not trying to have a baby, you don't need your uterus. And I don't think that's the correct thing to think about, because
Yeah.
there is a tie that we all have to our own anatomy. There's nothing wrong with wanting to keep an organ. Some women identify femininity with their uterus, and there's nothing wrong with it. And I think that's great. I think that, just like you're saying, the conversation needs to be had about what are your other options? What are other options that are viable?
And remember, I don't know that this was true or not, but I remember learning in medical school. Do you remember when they were saying hysteria
Yeah.
and
Oh,
hysteria?
okay.
Remember that?
Okay. Let's talk
Like
about that.
there's something to be said about
Mhm.
why you have your female parts and the
Mhm.
importance of that,
Mhm.
and how it can affect your mental health. Now, obviously, we're talking about 19th, 18th, 19th century. Ovaries are being taken out. Who knows what else was happening to these women?
Yeah.
But what we do know, especially when you bring the ovaries into play, is that it's bigger than just your reproductive health. There's a lot more
Mm.
going on in the body that is regulated by your reproductive organs, than just having babies. And so I think your point is well taken, that very thorough, detailed conversation needs to happen.
Yeah.
And some women will need it, right? There's some
Yeah.
women who need it done because it warrants that, their condition warrants that. But if you're hesitant about removing a part of your body that you've been with for most of your life, I think it's worth it to discuss what alternative options are out there. All right, my question.
Okay.
Yeah, I'm gonna take it. My patients are some freaky deeks. So this is the question we're gonna go with. Is there such a thing as a G spot?
Yes. And every woman should experience the sensation from her G spot. Long and short.
Enough said. Go find it.
Go find it and have fun searching.
Now, the one thing that if someone were to ask, how do you know where it is? Um, it's a collection of nerves,
Mm-hmm.
and the tissue is different. So it's a more of a smooth tissue,
Mm-hmm.
than a rugated
Mm-hmm.
tissue. Rugate just means folds,
Mm-hmm.
lots of folds. So if that part is identified, you'll know it
No.
because it's a very
Essentially, there will not be a question about that. But you're right. So, and where in the vagina? It's the what we would call anterior, but some women would think the top wall or the front wall.
Mhm, mhm,
And so that tissue
mhm,
layer is supposed to be different.
mhm,
Um, Maybe if you're not well versed in what how to differentiate, you might not really notice, but that should be a more sensitive area. And so there are some procedures that have been done in the past to um, increase the sensation in the G spot. Some negatives, some positives about that.
mhm.
But there is a
What are the
procedure,
negatives?
it not working,
Oh, okay.
infection and
When we talk
um,
about pros and cons, you
scar
got to be able to
tissue.
weigh your pros and cons.
The pro is the pro. Okay.
Need we say more?
Yeah. Well, because of what was being injected, but I
Yeah.
do a procedure called the O shot, and, not done in the same area as where the G spot is, but this is in the clitoris, and then right underneath the urethra. So that's the tube that takes the urine out of um, out of the body, and so the purpose is the same to increase sensation by stimulating, uh, nerve endings and blood vessels in that area, and to increase sexual satisfaction by strengthening your orgasms. But it's also good in other instances too. For women that have incontinence, it helps to, especially injecting it under urethra. Women that have lichen sclerosis, if you're wondering what that is, that's um, basically an inflammatory disease that changes the architecture of vaginal tissue, the vulva. So having some good healing is good for that population of women. Um, but for I think anyone who would enjoy a nice orgasm, a nice, strong, long orgasm,
That's a
I
good
think it's
indication.
beneficial for all. Yeah, that's
Yeah,
enough indication.
that's
Enough.
enough. Liking what?
Yeah.
I liken some.
Ah, and I've had some patients who they say their orgasms are fine, but they wanted to see if there would be a boost. And I got a call saying, "Thank you for the boost." Talking about COVID vaccine boosters, they were very happy with their booster. Okay.
Yeah, you going. Nobody will be taking a horse warmer in other than this one. Let me tell you, they're not going to say, "Oh, FDA."
Hey, you're not gonna need that.
They're
But
not going
the
to
other
ask what's
thing,
in it. They just
well,
let's
that's the other
inject.
good thing about the O shot. You're in it. It's your own. That's your own. It's your own blood components. It's your own platelets,
Hmm.
and so we get those platelets have growth factors in it. So the risk of using something that is not from your body is not there.
So it's
Because it's from
natural.
your body. It's not. If you cannot get more natural than using your own stuff. Recycle. I like to rewear outfits in a different way. You
Hmm.
know.
Yeah.
So that's
Well, I remember. Do you remember? We must have been in high school or early college when maybe this was in my mind and it wasn't really true. Janet Jackson, she had a piercing down there, and she had said, she just walking across the street happy. Like by the time she
yeah.
get to the other part of the crosswalk, she does she giddy.
Just walk back, keep
Because
on crossing that street.
the piercing is right in that area you talked about with
Mhm,
the O shot. It
mhm.
is, so she, she's smiling and
Oh wait, so she
smooth
was pierced
walking.
at her G spot, not on her clitoris?
No, I think it was on the clitoris. So it was
Okay.
that, in that I think on the hood.
And
So
I have you have patients that have clitoral piercings, right? And I think that's the purpose
oof,
for increased orgasms,
yes.
right?
But yeah,
I wouldn't
you
do
know,
that.
no,
No, I'd just get an O shot.
shoot me up.
Yeah,
Yeah,
I'd
I
just
don't
rather-
need, I just think of the worst possible things when you think
yeah.
of a ringed thing. So, and some
You
of them
know,
aren't ringed anymore. Some of them are just,
like
like a solid
bars.
ball. Yeah.
My concern would be it catching,
That's what all I think about.
right?
I mean, you want to feel something,
Yeah,
you want to feel something.
yeah,
Yeah, catch that
yeah,
on something.
yeah,
Oh,
yeah.
So
Yeah, you know what? I think honestly, when we think about having, especially these intimate procedures done, the best person to do intimate procedure in my mind for a woman is an OBGYN
oh
because
yeah,
that's our training.
yeah.
But if you're wanting to do something outside of your OBGYN's office, if they don't offer it or whatever, I think it's a good idea to run it by, think about it. Because like the vagina is not, it's not necessarily a clean area, and so if you have like piercings that don't heal well, that's a great place for infection.
Mm, yeah, it's, I mean, and I have many patients who take care of it really well.
Hmm.
Never had an infection before. It's just, I mean, whatever fits your fancy,
Yeah,
you
no,
know.
that's true. That's
Some
true.
people, it's just, it just, like Janet,
Yeah.
she just living her best life, just crossing the street. Everybody like, why she so happy? Why she smiling, big old
But girl,
smile?
I'm left and right with it.
Why, why
Every
she just
step.
look like she eyes rolling back just across the street? She must be listening to something nice. This was before AirPods. We don't even know what she's listening to. On to the next question, my friend.
So, this is not too long ago. I think there's a musician who attributes her vaginal odor and then also flavor
Mm,
to what she takes in, what she eats. Um, and so that's
which
the
is very
question.
true.
And so that's the question.
Hmm. Hmm.
Can my vaginal discharge taste different to my partner based upon what I put in my body?
Yeah, it's, you are what you eat in
Hmm.
every sense of the word. I mean, clean eating is so important. Vaginal health is so important. What you put into your body goes to every single part of your body. And so when you think about, I've had women who say, I sometimes smell like after I eat like a big thing of seafood, it smells like crabs. I'm like, well, if you're having crabs with beer and very concentrated drink and food, guess what? That's what your body
Hmm.
absorbs and that's what you take in. And so yeah, you can definitely, and this is not a knock against feminine hygiene products that are
Hmm.
out there. But I remember in training a wonderful mentor of mine who actually happened to be a man. So I was like, I'm gonna listen to you, boo. Um, when he was like, the cleanest vaginas are clean with water. Like you shouldn't need, if you are
Hmm.
if you're taking in the right stuff, if you're drinking adequate amount of water, if you're not putting toxins in your body,
Hmm.
I mean, Eve was up in the garden chilling.
She
I
didn't have
mean,
summer. There was no
she
summer's eve
she didn't
there.
have no she didn't have no suppository, nothing. She just
Nothing.
was out there. Animus, I mean,
There
he
was no
was
boric acid suppository that
nothing,
you no. There was none of that.
nothing.
She was using
And
water.
water. And it was
Mhm.
plentiful water. Okay, for those of y'all who read the good book, plentiful. So that's all she had, and so that's what I always try to counsel my patients to do. I don't say don't use it. Don't use whatever you're using. I just say, what are you doing outside of
Mhm.
that? What are you eating? What are you drinking? And how much of each are you doing?
Mhm.
If you eat a lot of sugary snacks, you have a lot of sugar, you're gonna probably have a lot of yeast infections.
Mhm.
Especially if you are borderline diabetic or diabetic. Like
Mhm.
you're just it's gonna have a yeasty bread like smell to it. Just
Mhm.
that's just your body breaking down what you've put in.
Mhm.
If you don't drink a lot of water, then whatever you take in lieu of that, is you're gonna kind of have that smell.
Mhm.
So I 100% counsel my patients to make sure if you are going to use the product, no problem, but make sure you're not putting a band-aid on something,
Mhm.
because you should be able to do a plie. You should be able to kick your
At 4 p.m. Well, you got a long day. You had a long day, right?
long,
Okay,
you
so
should
we all
be
know
able
that.
to
We all know
do
that.
that kick up in the air and wave it
And not
like you
pass
just
out.
don't care.
And not,
Okay. You should, you know what I'm saying? I'm just saying,
Oh,
you need to, and there's certain times of your cycle, it happens to all of us, when your pH is off.
yeah.
I know right before I know exactly when my pH is about to be off because I can't throw it in the air and wave it like I just don't care unless I take probiotics
Yeah.
to get
Yeah.
my pH back. So when you have a good sense, and that's why artists such as Erica Badu and Gwyneth Paltrow are
Hmm.
selling their scents because they think it smells good,
Hmm.
and they didn't need to put all this other stuff in there. But you just have to know your body, and you can only know your body when you're putting the right stuff in it, when you're clean
Hmm.
eating, when you're hydrating, you're drinking water, and you know when something's off. When
Hmm.
you know when you ate something wrong, you know when you ate too many sweets, you know when your period is about to come. You can regulate yourself
Hmm.
because you are in tuned with that. So yeah, you are what you eat. Drink as much water as you can.
Hmm.
Use probiotics when you
Hmm.
need to, but you really don't need much else but water.
Hmm. And you know what? I'm glad you phrased that. Don't put a Band-Aid on it. Using a deodorizer
Yeah,
in your vajayjay is
yeah,
not the best idea when you feel that you're off.
yeah,
Actually, the best idea when you feel like you're off is make an appointment
yeah,
to see your doctor,
yeah,
right? To see your practitioner that does that type of care because it may be something that you're not too sure of, that
yeah,
you're treating the wrong thing. So, and we're happy to see you and get you back on track.
yeah,
Don't be embarrassed. But I think also it can't be said enough. You are what you eat and you
yeah,
are what you drink.
yeah,
You are the amount of exercise you give your body. You are the amount of rest you give your body. You are the
yeah.
amount of stress that you allow upon
Hmm.
yourself. You got to be mindful of all that.
Yep.
And
She's sensitive.
she's
I tell people all the time, you can't just be having her doing
all
all this
types of
stuff,
ways.
hanging
Mm-mm,
off the chandelier,
mm-mm.
jumping off. She's tender. She needs, you can't do too much because you're gonna beat it up thinking you're doing something, and then you come to see me because she's tired
She's tired.
and she's spitting out some things.
Stop putting
Yeah,
apple cider vinegar in your vagina.
please stop,
That one's just stop. That
please.
just does not need to happen. You can
Mm-mm.
drink it. I don't care. Just
Mm.
don't.
Vinegar, y'all.
Yeah,
Unless you're undergoing a colposcopic procedure,
you don't need it in your vagina.
you don't need
And
vinegar
we
in your
only use a
vagina.
lot. I mean, a little bit. We don't use a
Yeah,
lot.
exactly.
So,
Yeah.
and be
So,
mindful of your products. Be
yep,
mindful of your products. So, because a lot of the stuff has fragrance and preservatives, alcohols.
yep,
You're not
yep,
trying to put rubbing alcohol in your vagina, so don't put a product that has it.
yep. But that's the honest thing that women need to understand. Your vagina is not supposed to smell like warm vanilla.
Yeah.
It's not supposed to smell like peaches and cream. I know 112 told you that it is, but it's not. It's just supposed to be. It's just supposed to kick it in the
be,
air.
be itself,
It's
right?
supposed to be itself. You ain't supposed to be jamming the peaches and cream and strawberries and coconut. It's not. It wasn't made for that.
Ah,
It's not a
so
platter.
that Tahitian vanilla scent ain't it? That's not it.
It's not it. She
Oh.
does not like that. You may like it. Your Neres may love it. She hates it. She
Hmm.
cannot stand it because it's concealing who she really is.
Hmm. Yeah. Be you. Be you,
Be
boo.
you. Be you, boo.
All right. You know what? Let's do one more question. I know we said I said that's it, but let's do one more.
So this is a patient of mine, 28 years old, sweet girl, just got married over the summer, wants to make sure she can get pregnant. She wants to get pregnant in the next year or so. So her question to me was, is there a test that can tell you how fertile you are?
Um, I always wonder when I kind of look away, does it look like the answer is no?
No,
The
it just
answer,
looks like you're
I'm
thinking.
thinking, okay,
Yeah. Like how do I
put this, okay.
put this? Yes.
Because I don't want to say no, because I can't tell your fertility until you show that that you have a challenge with fertility, right?
Yeah.
I can't 100% say,
Yeah.
but I can say what is the likelihood of you being able to get pregnant, understanding that in 1 month, the chance of any woman that does not have some type of fertility challenge to get pregnant is about 20-25%, right? Our
Yep.
fecundity. That's your word. You like
Fecundity.
that
That's
word.
my word. I throw it everywhere. I love that word, fecundity.
So that's your 25-year-old woman who's not had any fertility issues. Every month, she has a 20-25% chance of being able to get pregnant. Now, your ability, your fertility does decrease as you get older because you're getting older and those eggs are aging.
Hmm.
So that's just also a plain known. So what we can say though is we can know how many follicles your ovaries produce. You know, the more follicles, the higher the likelihood that you get pregnant is, and we can tell that count by an ultrasound. We can tell that by certain blood tests
Hmm.
to tell us. But other things that impact fertility are just your health status. You know, having chronic diseases like diabetes or hypertension can impact your ability to get pregnant.
Hmm.
Your anatomy, your uterus, your fallopian tube. So, you know, if we're talking about your fertility based upon your ovaries, we can pretty much gauge, but there are other things that impact your ability to get pregnant. One thing I always love to say when I'm talking to a patient about fertility and
Hmm.
ability to get pregnant is it takes two to tango.
Yep.
So it may not just be you, boo. Okay. We got to talk about the other side too. And so there's something called male fertility.
Yes.
You know, some cultures, especially cultures, the culture we come from, um, oftentimes put fertility on a woman. I think in America too, honestly, if you really
Everywhere.
say everywhere, it's
Hmm.
like it's your fault you can't get pregnant.
Hmm.
That's not
Hmm.
necessarily the case. There's somebody
Hmm.
else that should be helping you do that.
Hmm.
So
Hmm.
if you were having challenges getting pregnant, no matter if you know you have a condition that increases the chance you will have a challenge in time to get pregnant, your partner needs to get tested too, because it actually might just be
Hmm.
them, not you.
Yeah. And, I always say for that 25, 28, 30-year-old woman, I say we expect it to take up to 2 years. Like
Hmm.
normal, healthy, nothing's wrong. The reproductive endocrinologists say 2 years is usually the time it takes.
Hmm.
Now, it may seem like that's not the case because everyone around you is pregnant and it seems like
Hmm.
everyone has gotten pregnant so easily, but you have no idea when they started. You have no idea what
Hmm.
they've needed. You have no idea what the background to that is. So we usually will not do anything or do workups until we hit like a year and a half of unprotected intercourse every month. Because
Hmm.
again, as you said, the fecundity rate is 20% per month, but as you continue, it's additive. So by the time you get to a year, you should be approaching a 90% success in pregnancy. So usually by the time we get to a year and a half and you haven't gotten pregnant, we'll do some testing. But
Hmm.
I think what you said is spot on. By the time we're getting there, we have to test the male too.
Hmm.
Because I always say there's a poor woman's way of seeing if you have all the parts, so to speak.
Hmm.
You need four things to get pregnant. You need an egg, and that egg comes from your ovary. So you need to be able to, make sure you have an egg. How do we know that your egg is coming out there? You're ovulating every month. How do we know you're ovulating every month? You're having a period every month. So
Hmm.
poor women's way of knowing that you're ovulating, do you have regular periods? That's
There
the
you go.
first thing you need to ask yourself. If you're
Hmm.
not having regular periods, then you might want to see your OBGYN because there could be a reason with ovulation and that could be part of why you're not getting pregnant. The second thing you need is tubes because you need a tube that's going to carry that egg down to be fertilized by the sperm. And so, similar to what you said, if there is a history of an infection, an STD, gonorrhea, chlamydia, particularly, then there's a chance it could be blocked. If you've had surgery to that tube, if you've had anything that could have affected that tube, that could be a reason. Your uterus, your womb, what's going to carry the baby
Hmm.
is another big piece of what you need. And so, yes, a majority of that does fall on us because 3 out of the 4 are ours.
Hmm.
But again, it's another way that you can check a box to say, I think I'm good. I
Hmm.
have regular periods. I've never had an infection. And I have, never been told that I've had any issues. My uterus isn't too big. My periods aren't too heavy that would suggest maybe having fibroids or something to that extent. And then the semen analysis, you need a sperm to
Hmm.
fertilize the egg. So, I always use that as kind of once we do the female checkup and all of that is fine, I go to the male, because most of the time, if the female's fine, there's something with the male, understanding that 33% of the time we just don't
So
know
no.
why everything's
Yeah.
fine. So I think, the poor women's test is always a good first sense, right? So if you know that you get regular periods, you haven't had infections in the past, you've never been told you had fibroids or polyps or any issues with your uterus, then rest assured that maybe it's going to take a little while, but you probably don't have any issues. But if any of those other things have been an issue in the past, or you've been told that there's been an issue with that in the past, don't wait. Don't wait until
Mhm.
you've gone 2 years. Don't wait till you've gone 5 years. Talk to your OBGYN. Maybe you might be the cohort of
Mhm.
people that need to do testing sooner.
And if you're 35, 36, 37, 38, 40, 39, 40, and you're starting out for the first time,
Hmm.
you haven't gotten pregnant in 6 months, there's nothing wrong with, making an appointment a
Yep.
little bit earlier. I tell my patients that are 40 and above, especially those trying to get pregnant first time, even if you want to start out
Yeah.
seeing a specialist, that's very reasonable,
Yeah. I
because
think
your window's shorter. You might want to meet
exactly.
clients. Dr. Ada Amiraway, thank you so much for
No
joining me. I look
problem.
forward to doing this again with
Yes.
you. If you have questions, especially those related to fertility, please put it in on our Facebook. You can send us a direct message. What do they call it? Private message?
Probably.
Yeah.
I'm not on Facebook, girl.
You can send us a private message and we'll bring your question to the broadcast and answer it. Um, Again, thank you.
Thanks.
I'll talk to you later.
Bye.
Bye, everyone.